welcome to RCSI in the middle of this Science Week. It's a very apt week to have our latest MyHealth lecture. My name is Fergal O'Brien. I'm the Deputy Vice-Chancellor for Research and Innovation here in RCSI, and I'm delighted to welcome you here. And I really want to thank everyone for coming here tonight to hear something that is so important. I don't think there's a family in Ireland or beyond that hasn't been affected by this topic. So tonight's MyHealth lecture is on coping strategies for life with cancer. And I think you'll agree when you hear some of our speakers and some of our panelists that we have got a really wonderful, distinguished panel here tonight. In the background, I want to draw your attention to something. And that is the forthcoming launch of our new public engagement space, which is opening in our wonderful new building in St. Stephen's Green, in 118 St. Stephen's Green, later on in 2025. And in 2026, we're going to launch our first exhibition in this public engagement space. This is a really, really exciting initiative that we're really proud of. And I see it in some ways as a physical manifestation of the MyHealth lecture series. It's going to allow people not just to hear, but to actually come in and interact with patients, with scientists, with researchers, with clinicians, and learn more about their health and allow their viewpoints to be taken on board and to direct our research. I want to thank the many supporters of tonight's events, and for people who've been wandering below, and we'll later come down to a reception later, you'll have seen some of the support stands from BRCC Soul Snacks, from Breast Cancer Ireland, from the Irish Cancer Society, from the Irish Hospice Foundation, from ARC Cancer Support, from Canteen Ireland, from the Alliance of Community Cancer Support Centres and Services. So we really, really appreciate the support of our supporting partners tonight. So without further ado, I'm going to pass over to my colleague in RCSI, Dr. Pádraic Dunne, who's a senior lecturer in the Centre for Positive Health Sciences, who's going to lead the discussion here tonight. So thank you.
So thank you very much, Fergal, for that introduction. And can I just say a very, very warm welcome to everybody here. I can't tell you how fantastic it is to see real people in those seats. Because the last time we had real people at the MyHealth series, I think, was in February 2020, if I'm not mistaken, which is a long time ago. Now, we've had a lot of episodes since. It does go onto a podcast. It's on YouTube. But you can't beat this, right? This is fantastic. So my name is Pádraic Dunne. I'm from RCSI. And this particular RCSI MyHealth episode is called I Don't Know How to Feel, Coping Strategies for Life with Cancer. Very, very important topic. We say all topics are important, but this one really, really, really is important. And just to say just one little thing about the RCSI MyHealth series, which is actually a really important point in terms of the big team behind the RCSI MyHealth series that organize and make this actually happen. And we're obviously very grateful for those individuals in RCSI Communications. And to that effect then, the RCSI MyHealth series was announced as the winner of the Best of Europe Region Awards 2024 by the Council for Advancement and Support of Education. So that's a really big thing. And I think everybody deserves it. Thank you. Thank you very much. So just before we begin by introducing to our wonderful panel here left and right of me today, we'll all acknowledge, I'm sure, that this could be an emotive topic. You know, as Professor O'Brien said at the start, there really isn't a family in the country or globally really who isn't impacted by this topic, including mine. So this is emotive. This can trigger memories. It can trigger a lot of things. And that's okay. And we want you to know, first of all, it's okay. Second of all, that this is a safe space for that to happen. And if you need to get up and move outside and get a glass of water or just take a breath, no problem. Or go downstairs, visit the stands, relax, you're welcome to come back in the room again. We acknowledge this, it's really important. So please bear that in mind. Now, you're going to hear this number many, many, many times today, Corrinne, and I'm going to try and remember it. And this is the number, the only number you need to remember today, and that's 1800 200 700. All right?
Perfect.
And that's the Irish Cancer Society number. And that's the number you need to have in your notebook or in your phone right now, because that is the support contact number. So if you do feel a little bit emotional, you feel like it's pushing you a little bit, that's okay. You've got supports on that line. Now, you also can talk to people at the end of this evening downstairs, have a chat with each other, decompress. It's a weighty topic, but there is hope in all of these topics, and I hope you'll see that. So I hope that makes sense and that's okay with everybody. So I'm going to start by introducing our fantastic panel. So to my left, we have Dr. Alicia Brennan, who's a patient advocate, RCSI alumna, pediatrics SPR, and 2015 Rose of Tralee. I won't ask Alicia which one is more relevant or important. And then we have Mr. Alan McGovern, who's a family and patient advocate. And then to my right here, we have Dr. Maria Pertl, who's a lecturer at the RCSI School of Population Health. And Maria's going to talk about her research today, which is really important that's related to this topic specifically. And then to my right, immediately here, we have Dr. Vicky Cooper-Lunt, who's a principal clinical psychologist, Psycho-Oncology service at Beaumont RCSI Cancer Centre. And for those of you who aren't aware, Beaumont is one of the prime hospitals that's linked. It's part of the RCSI hospital group. Really important that the campus and the hospitals are mentioned together, I think, Vicky. So, and then finally, but certainly not least, from the Irish Cancer Society, Director of Services, Corrinne Hasson. Thanks very much. So thanks very much, everybody, for joining us. And I'm going to start with a question for you, Alicia, if that's okay. So can you give us an idea about your cancer journey? Every cancer journey is unique, and hopefully everybody will get the take-home message today that there is no one-size-fits-all approach. There is no one story that applies to everybody. So it's really important that we hear from Alicia and we hear from Alan today. So in terms of your story, Alicia, if you could tell everybody how it began, but also then the journey in terms of the diagnosis journey, the treatment journey, and then I think something that we're all going to talk about today, which is what happens afterwards when those support structures actually are in the rearview mirror, hopefully. What happens then? What does that feel like? Is that okay if we start with you telling us a little bit about?
Perfect. Thank you so much for having me today. It's a real pleasure and a privilege to be back. So I was 19 when I was diagnosed. I had, I think, which is a universally shared experience among so many people, quite a convoluted and tricky course to diagnosis, which I think, having spoken to lots of people over the last number of years, is a shared experience. You meet lots of different doctors, your GP. My symptoms were I'd lost a lot of weight. I had lymph nodes enlarged in my neck. Was feeling really anxious, very, very tired, napping during the day, which was new to me. But it also coincided with me repeating my leaving cert to try and get into medicine. So you can imagine when people, meet a 19-year-old that's stressed studying for a leaving cert, cancer isn't high up on the differentials of what's wrong. They think this is just normal, you're exhausted. I'd had lots of different viral things. They said the lymph nodes are just up with same. So I'd met lots of different doctors who had reassured me. And I'd kind of get reassured for a couple of weeks. And then there was just this gut feeling that something was wrong. And I think, again, having reflected back on it and spoken to lots of different patient advocates, they can relate to that feeling of just not feeling right in your body, that gut, strong feeling and intuition that something just isn't right. My mum is still a nurse, but brought me in to see her friend who was a consultant in the emergency department and said, look, we'll refer you for a biopsy. But it was almost like a therapeutic biopsy to say nothing is wrong. And the lovely man that did my biopsy said, we see this the whole time. Don't be worrying. It'll all be fine. So I got lots of reassurance throughout the year, but it was about a 10-month time from me starting to have symptoms to the diagnosis. And had the biopsy and was on study leave for my leaving cert. Repeat year, it had all finished up, and we got a letter to come in for our appointment for the results of the biopsy. And so I brought in my biology notes and was sitting in the waiting room of ENT in Beaumont. And there was 2 different doctors that we could see working in the clinic. And my mum and I were in stitches because one of them looked like McDreamy from Grey's Anatomy and one of them didn't. And we were like, I hope your man calls us in. So, I mean, we were laughing and giggling, and I had my flashcards, and, you know, I don't think either of us really thought that the next couple of steps into a treatment room were going to change the course of your life forever. So we went in, and the very handsome young doctor said, we've got the results back of your biopsy. It's a tumor of white cells called lymphoma. And my mum, with her medical background, just broke down, and I didn't understand what was happening. And then he finally used the word, you know, it's a type of cancer. And I just remember earth-shattering silence after that, like feeling like your whole world has just imploded and collapsed in on you. Anyone that has received a cancer diagnosis, or I'm sure been there to support someone or been in a room where a cancer diagnosis has been broken, will know that feeling. Total and utter shock. There was a pause, and the first words to come out of my mouth were, am I going to die? Which I think a lot of us, I mean, even with amazing, incredible advancements in cancer and survivorship, think cancer and death, you know, they're linked. I'd been very lucky in childhood. It hadn't touched our house or knocked on our door in our immediate or kind of close family. So just total and utter disbelief and shock. And then the wheels started to come into motion, which I'm sure a lot of people can relate to. You know, there's talk of CT scans and staging and bone marrows and lumbar punctures and getting organized for chemotherapy and all these big, bold, scary words that you just never thought were going to be in your vocabulary. So that day was probably one of the most challenging days of my life, telling my brother and sister, who were only 15 at the time, telling my friends, trying to wrap our head around it. But then we very much so, as a family, I think, went into a real practical mode, which in retrospect was a good coping mechanism, and it suited us in that, okay, our next appointment is, you know, Tuesday for the CT, and then we need to get this organized, and I need to get on to school about the exams. And so we went into a very, I think, practical mindset and approach. And then I sat my leaving cert, and in between, I think chemistry was one of my last exams, and then ag science, I had a bone marrow biopsy. And I work in pediatrics at the moment, and I look after children with leukemia and solid tumors and cancer, and we do bone marrows when they're asleep. And I always just think, you know, if I had been a couple of years younger, I would have had it asleep, but I had it awake. I remember that feeling. I'm sure lots of people in the audience have been through something similar, and it's not something you'd want to put anyone through.
Sure.
And then we finished my exams on a Friday, and we started chemotherapy the Monday. So it was, I think, a survival mode. You go into that place where it's just fight or flight. You're just getting from appointment to appointment, waiting on the next scan, waiting on the next blood results. So I had kind of 4 or 5 months chemotherapy, and then 6 weeks of radiation, and finished up just after Christmas in 2012. And thankfully have been well from an oncology point of view since. So I'm very conscious. I don't want to be preaching from a place of privilege,
Sure.
but as we were chatting before the event, the most challenging time that I've only really come to respect is actually transitioning back into normality or life, because when you're within a system, you're so well protected, and there's appointments and there's doctors looking at you, and you're getting your bloods done, and there's upcoming scans. And I remember once I hit that 5-year mark where they kind of went, good luck, God bless, I thought, oh my God, what do I do now? And every ache and pain, you know, there won't be someone checking me in a couple of weeks. So I found that really tricky in transitioning back into college. And, you know, my friends were all a couple of years ahead of me in terms of relationships and careers and traveling and all the rest. So transitioning back into some sense of normality and finding your identity after having your whole identity be about cancer for so long was really tough.
Can you explain a little bit more about that, Alicia? Because I think that's a really important point. So your identity got swallowed, did it, during that process? And when you come out the other side of it, then when those organizations and support structures kind of go into the rearview mirror, you feel like you're trying to gain your identity again. And what's that like?
Exactly. And I think what cancer or illness in any shape or form can do is strip you of an identity
Right.
you thought you had. You know, when someone says to you, "What's your 5-year goal? What's your passion?" You don't think it's going to be fighting an illness
Yeah.
or getting through treatment. You
Sure.
know, it's not something I think anyone has in their bingo card
No.
for life. And there's such mixed feelings of guilt about bringing it into your family dynamic as well. There's feelings of anger. Why me? I certainly, like at 19, looked at my peers and thought, what have I done wrong?
Right.
Why do I deserve this?
A kind of sense of injustice.
A sense
Yeah.
of injustice. And then maybe it was the age I was at, but consistently looking at other people that were the same age, doing things that I wanted to do that I couldn't do or that I had
Right.
missed out on. And dealing with all of these feelings whilst also being like, who am I in the world? You know, what do I want to do? And regaining your strength physically, mentally, emotionally, your resilience. It was really hard transitioning back into just day-to-day life.
So we said there's no one size fits all, and every story is unique. Did it take longer for your emotional and mental health to return to pre-cancer than the physical? Is that fair to say?
I think that's absolutely fair to say, and something which I'm 31 now. Something which I've only acknowledged over the past couple of years is actually what I've gone through.
Right.
I don't think I fully absorbed or allowed myself to absorb and fully comprehend the gravity of something happening so young in my life. And I think that was just total coping mechanism and survival mode. When you're in it, your only goal is to get better and to move on and never think about it again.
Right.
I found kind of my later 20s, different behaviors and different feelings and different triggers were coming up. And I thought, where is this coming from? And it's only then I actually engaged with psychotherapy,
Right.
which I had never done. So kind of coming up to 8-9 years after a cancer diagnosis, sitting in front of a psychotherapist, bawling about everything I've just told you about that whole journey and reliving it. And she said something so profound to me. I said, why haven't I engaged in therapy before? This is transformative. This is life-changing. And she says, it's only safe now. It's only safe now that you can do it. You're allowing yourself to feel it now because it's safe, because you're in a good place.
Right. And that resonated completely.
Really, it did. Yeah. I think you will seek the proper help and advice from a psychological and emotional support point of view when it's safe and when you're ready.
Yeah.
But at the time, I think it's really normal to just go into survival mode, practicality. You know, I had a diary. I was neurotic about next appointment, next scan, blood work, you know, all the rest.
I mean, it sounds like a surreal roller coaster that you're just coping, you're hanging on, you and your family. As you said, you're in survival mode and then stop. And I really want to come back to that point of stop and after that. And you say, how many years did you say again? Was it 9 years?
9 years
9
after
years.
diagnosis to engage in therapy, yeah.
And those kind of behaviors and feelings and thoughts, they seemed like they were coming out of the blue, nowhere, completely disconnect at
Yeah.
that moment for you, was it?
Yeah, like if I saw something on television, or I was treated in Beaumont Hospital and I ended up being working in Beaumont Hospital for my first year as a doctor. And I mean, I used to get called to review patients on a ward where I used to sit getting chemotherapy and feeling so upset, and then bringing that upset and anxiety into different aspects of my life and not really truly understanding it. So there was a lot to unpack.
Right.
But equally, I remember saying to my amazing psychotherapist, you know, why didn't I do this sooner? Why, you know, it could have changed so much. It could have put me on a better trajectory in terms of my mental well-being. And she said, you can't be hard on yourself. You came at the exact right time when it was safe.
Okay. And that's an important message for everybody who's here to
Exactly.
land with, and anybody listening in a podcast
Mhm.
later. Okay. So I would like to come back to that stage later, if that's okay, because I think it's important. But just to focus on the earlier parts of the journey, so diagnosis and treatment, and really just in terms of, and it's a question for Corrinne and for Vicky, really. If you start with you, Vicky, if that's okay. What supports are available for the individual, you know, at diagnosis, you know, that surreal roller coaster phase? What's available for the person at those phases?
Thank you. So I can talk to what we do in Beaumont Hospital best, but also want to talk a little bit about Corrinne's services. I know a few of my Daffodil Centre colleagues are in the audience. So there are some formal supports within the acute hospital settings. So we are very lucky in Ireland. We have 8 cancer centres of excellence, and there are Psycho-Oncology teams within that. And if you were to feel at the time that you would like to engage with somebody, you're very, very welcome through your medical teams to request that referral.
And
But-
sorry to interrupt, Vicky.
No.
I just think that phrase, psycho-oncology, is an important
Yes,
phrase. What does
absolutely.
that mean for anybody who hasn't come across that?
So really, it's just a group of multidisciplinary professionals. We've got a lovely psychiatrist on our team, some psychologists, nurse specialists, and social workers, and we're really there to support your own coping. So one thing that really struck me when Alicia was talking, each person in this room comes with so many coping resources, such resilience within them. But sometimes those coping resources are just outstripped by the demands on you. It's not every day that you sit in front of a doctor and receive a diagnosis. Sure. And so our services are really there to augment what you already know works in different situations. That might be through a referral to someone like myself and our team in Beaumont Hospital, but it might also be that you prefer to receive that support in your community. And then someone like Corrinne, in terms of their services for the Irish Cancer Society, where we have the Alliance of Cancer Centres, areas in your own communities, and things like our cancer support centres. Hi, Billy, I know you're in the audience. Our Pertl House colleagues over in Bray. Down the west, we've got Cancer Support West services. So those services that are closer to your home. And then don't forget the peer support services. You know, linking in with the Irish Cancer Society, they can match you up with their peer support services. Someone like you, either with the same diagnosis or some of the challenges that you're meeting. So that's the piece at diagnosis. But we also say to people, at diagnosis, be thinking about the other end. So Alicia said a little bit about her post-treatment experience. But a lot of our patients say to us that getting to the end of treatment is really, really frightening. And to quote somebody, that you feel like you're being pushed off the edge of a cliff. So we like to talk about our post-treatment services, even from the beginning. So things like our Cancer Thriving and Surviving groups, the LACES program through the Irish Cancer Society, the XWELL program, which is an exercise post-treatment program. These things that can feel like a little bit of a wraparound when you do feel like you're just on your own at the end.
That's super. So the key word here is psycho-oncology, and these supports are available for people at different regions around Ireland, in effect.
They are, and the way that Ireland is set up is we have our regional cancer centres, but we also have what we call our SACT hospitals, those systemic anti-cancer therapy hospitals. So, for example, in Beaumont, Our Lady of Lourdes is our satellite hospital, and those patients are also very welcome through their consultants to receive supports from ourselves, and that might be from psychology or psychiatry, nursing, etc., or we'll meet you, signpost you, and you may end up with some of Corrinne's services as well. So we try and signpost and we try and serve, but it really is up to what the individual person needs.
Sure, thanks very much, Vicky. And speaking of Corrinne and the Irish Cancer Society, 1800, 200, 700. Told you you'd hear it again. So it really sounds like there is a partnership and a collaboration here with Psycho-Oncology embedded in our hospital systems.
Absolutely, and Vicky is spot on. My God, she should come and join our comms team in the Irish Cancer Society. But what we try to do is to personalise everything that we're doing for every single person. Like we said it already, it's not a one size fits all. And quite often what happens at the point of diagnosis, somebody might be in Beaumont and they might walk down to Valerie, who's up in the audience, and she might be the first person that people are having a conversation with. And it might be just to make sense of what they've just heard from their consultant. Maybe some words were used that they didn't understand. So it's really just a chance to have that initial conversation with somebody who isn't a family member, so you don't have to worry about upsetting, and to really kind of get your own head in order. And then also people will go home, they'll pick up the phone and call the support line. And at that point, our nurses are starting to think, what services does this person need? People will start to talk about chemotherapy, and they'll talk about, how am I going to get to my chemotherapy appointment? We have a transport service. They'll get them referred on to those.
Sorry, Corrinne, I'm going to interrupt you now again.
Yep.
Excuse my rudeness, right? But you use an important word there, nurse.
Yes, oncology nurse, I should
Right.
say. Yes.
Oncology nurse.
Yes.
So the people that are on the other end of that phone line,
Every
oncology
single one of
nurses.
them. So our daffodil centres, we've 13 of them across the country. And then our support line, every single nurse that you will speak to is an oncology nurse. So
Right.
they have the expertise, they have the understanding, they've worked in the wards and the different clinics for years. So you're getting that expertise. And if you call the support line and maybe you've been diagnosed with breast cancer, that nurse mightn't have that specialism, but she's in a group with 12 other nurses. So you're kind of getting the benefit of all of them. But the key is that personalization, because some people want the counselling at the very beginning because they need to make sense of it. But like Alicia said, sometimes it's years later whenever everybody's telling them, oh, you're over your cancer, sure, you're looking great and you're feeling well, and we love to make everybody feel great about themselves. But sometimes that's whenever the impact of what you've been through. And for a lot of people who've maybe had a surgery, you know, their body is maybe now physically different, and it's maybe years down the line that they're coping with the fact that physically their body's different. They maybe have a symptom that has continued throughout, you know, the course of their treatment and beyond, maybe infertility. So there's lots of different things, but the key is that our nurses at every point will be thinking, what do you need right now? So between our counselling service, the peer support service, and it's such a vital service. I had a lady a couple of months ago who emailed me to say, I'd love to become a peer support volunteer. She says, I was diagnosed with cancer a few years ago, and I called Irish Cancer Society. I didn't know why I was phoning, but I just phoned, and I was matched with a lady. She says, that day I was given hope that I could survive my cancer diagnosis. And she says, if I can do that for one more person, that's what I'd like to be able to do. So she's now becoming one of our peer volunteers. But I think the key is kind of the right service at the right time for that individual.
right? So I see Vicky nodding beside me. Alicia's nodding as well. This is key for everybody.
Absolutely.
Right time, right person, bespoke, not here's a protocol that applies to everybody in the room.
Yeah, yeah,
This is, so those oncology nurses are talking to me
yeah.
and adapting to me and what I need, and I might not need counselling right now. I might need something else.
Yeah, yeah. And they're also talking about your family and who's at home to support you and all the different complexities. A couple of years ago, we introduced a lot of survivorship services into the Irish Cancer Society. And one of those is our welfare and supports team. And that's a team of people who will talk to you about all of the non-medical stuff. So how will you get your appointment? You know, with the financial impact of a cancer diagnosis, which is huge because for a lot of people, they're maybe out of work, so they're down in income. But then the bills start to transport and car parking in hospitals and all of that starts to increase. So they're a group of people who aren't medical, but they're there to talk to you about all of the different practical concerns that then arise from a cancer diagnosis.
And that's hugely important. Those
Yeah.
practical things can become enormous in the background
Yeah.
and add to something that's already big, right? I mean, that's such an important thing. And
Yeah.
again, it warms my heart that these stories, you know, there's a collaboration between two very important support services, you know, so thank you. I'm conscious, Maria, that you've got an awful lot of important research that you're undergoing right now. And I want everybody to be waiting in anticipation to hear about that story. But before I do come to you, I'd like to go to Alan, if that's okay, Alan.
Hi.
So you've got a really important story to tell, Alan, and it has to do with your wife, Jenny. Can you tell us about that story?
Yeah, I can. And hello, everybody. I feel very blessed amongst qualified people here. I'm not a qualified professional, but maybe qualified a little bit through life experience. Jenny, my late wife, celebrated her 40th birthday on the 21st of December 2017. And on Stevens's day, we were sitting on the couch and the kids had gone to bed and we were enjoying a bottle of wine, and she just turned in and had a massive episode of excruciating pain, had to call an ambulance. And that was the start of the journey, I guess, for the want of a better word, for us. And so much of what you said resonates with me. There wasn't a straight line to diagnosis. There was a lot of severe illness, gastro illness, throughout the next 8 months, and which accumulated in a biopsy, which sounds ridiculous that it took that long, but it was understandable at the time that it took that long. In August 2018, which showed cancer in the top, body, and tail of the pancreas, and some mets into the liver. It was stage 4. It was inoperable, completely inoperable, and really she had on maximum until Christmas to live. The diagnosis at that time, because she'd been so sick and because she really wasn't getting any better, it wasn't a massive surprise, but it still was incredibly, jolting. And both of us were together when she was told. There was a lot of silence when she was told, and then for the next 36 hours there was a lot of tears, a lot of disbelief. There was so much to try and take on board. And then, led by her reaction to it, which I completely don't take responsibility for, I just rode in behind it, she said, okay, I've one option here, and that is to try and do the best that I can to try and whether it was, we never discussed how long to live, she never wanted to know that, what looked like a good result for her. We never discussed that. It was just getting through and living as long as possible with this. And she transformed and turned into the most positive cancer patient that I've ever come across. And that's why I'm here, in the hope that somebody can take a little bit of that and bring it into their own, journey. And she just became completely open about her diagnosis. She was, she was active on social media. She was pushing her story out through that. The papers picked it up, and she was interviewed a couple of times, and she put everything into perspective. She actually, in one of the interviews, said about a month after diagnosis, I strangely feel more content than I've ever felt in my life, because the expectation around the rest of her life, she was a thriving businesswoman who, had 2 gorgeous kids. She'd so much to lose, but yet she felt so content that she had come to terms with her diagnosis. She was going to call on as much help and as much community support, family support, friend support that she could possibly do. She was very open with the medical teams. She handed everything over to them and said, you're the guys that can help me live as long as possible. Do what you need to do. Cut to Christmas. She just finished chemo, and the cancer was virtually invisible to an oncologist. And then suddenly, in the first week of January, the surgical team came in and said, now she's operable. And although she wasn't particularly well still, she still had a lot of symptoms, mostly gastro-related. She was operated on the 13th of March and had a full pancreatectomy. She had a portion of her stomach removed. She had her liver cleaned up because there was spots on that. She had her gallbladder out. And the day after that, she was cancer-free. So there was no evidence of disease. Well, yeah, I don't know if that's the right terminology, but you get what I'm saying.
Yep.
And she lived a really, really happy and healthy 2 months. And I know that sounds ridiculous, but they were invaluable 2 months. Her kids had grown, 9 months older. She got more memories. They got more memories. And then 2 months after that, her tummy started to swell, and she died on August 7th, 2019. So I'm here to try and give people a little bit of perspective of how positive a cancer, even with a devastating outcome, can be, and what you can do for yourselves to help make that a little bit easier. And if it's okay, and I don't know if I'll be able to get through this is the essence of why I'm here, and it's the essence of what I took out of our whole cancer journey, well, Jenny's cancer journey. But this is an extract that I found today from an article that was in one of the newspapers. And it's her words. For me, it was hugely important to be open about my situation with everyone around me. I had to be straight up, not only with family and friends, but with the mums in the kids' school, my clients, the staff and work. The openness from the start meant I had a huge amount of support, and I never could have anticipated how important this would be to me. By the time I had finished my chemo in December, the endless messages and visits had carried me through. I know that if I hadn't been so open and upfront, I would have deprived myself of this endless love and support that continues to drive me on. So that's, in her own words, what being open and honest. And there was loads of little things during that year that worked for us, and they may not work for other people. But an example of that is 2 weeks after she was diagnosed, her and I went away to a hotel for a night, and at that little night away, we discussed all the dark things that went with this diagnosis. So we discussed death, we discussed what, her wishes for the kids, we discussed where she wanted to be buried, we discussed all of those grim things that nobody ever wants to discuss, and we discussed them over a drink in Paris Court Hotel. And what that allowed us to do as a couple and as a family was then move on with the treatment, and we never spoke about that again.
Okay.
She died on August 7th. I never had to have those conversations with her. It was just about minding her and caring for her. We had amazing family and friends once she became so public that weren't afraid to pitch in. My brother took over life admin for us, for example. She handed all her medical kind of, appointments and tests and scans to me, and I managed that part, and we managed the kids together. And we just, by accident, it just became this well-oiled machine that made her life, I hope, a lot easier and gave her the chance to have some really positive memories. But if you take what she wrote in that article, and it's not in that piece that I just read out, it's the piece that I said at the start, is I feel strangely more content than I ever have in my life. And that to me was a win. So
Sure.
and then dealing with the kids, it was something which we were very honest and open about at an with age appropriate language from the start. We told them that she had cancer. We told them that she's going to really get some really strong medicine that will make her hair fall out, that she's going to really try and get rid of this cancer. And cancer is like an infection that the body really struggles to get rid of sometimes. And as the year went on, and we left it very open and welcoming for them to ask questions whenever they felt they wanted to. And, obviously the question came up, is she going to die? Mostly from my older boy. And that came up at the start, the middle, and the end. And we were very open about the answers around that, saying at the start, some people do die from cancer, but mummy is going to try and fight this. She's getting the best treatment, and that's what she's trying to do. And then as we progressed towards the end, we had to change the wording to that. And that was mostly me at that stage, because I guess Jenny never really, wanted to talk about dying, and that was her prerogative, even though she knew it. And that was perfectly okay with me as well. She didn't want to go to a palliative ward. She wanted to be in a mainstream ward, and that's all individual, people's decisions. But then I would say, look, there's a chance that mommy might die. And, and then it became, mommy's probably going to die. But because that openness was there, it became a lot easier to talk to them about it in a really open way from the get-go. So nothing was ever hidden. There was never a chance of them hearing from somebody else or getting uneasy with somebody calls to the house. Or Jenny had spent an awful lot of time in Vincent's during that year. So they were, there wasn't a shock that she had to go back into hospital. The worry was kind of hopefully reduced for them.
Yeah.
So that's my story, and it's really built around being open, asking for help. Don't be afraid. Around the psychology services, you mentioned Pertl House. I forgot to mention that upstairs. They've been amazing. Irish Cancer Society, the Hugh Cooney Foundation and Vincent's were amazing at the time as well. And for me as well, then I never had a psychology session before, but as soon as she got diagnosed, she encouraged me to go and speak to somebody, and I still see that very same psychologist today.
Really?
Yeah. So I went initially once a month, and then probably the middle of that year it became once a week, and then she died and it became once a week, or continued at once a week, and now it's once every 2 months. And it's just those memories pop up. There's a lot to deal with. There's a lot of emotion with the kids, and that will never end for me, because there's a lot of trauma there that I processed in that year, and the kids processed, and that's where the psychology has worked for me. I couldn't speak highly enough of it. So that is our story in a nutshell.
Well,
Absolutely.
and richly deserved. And first of all, thank you for reading that really important piece, because I'm sure everybody appreciates it's not hard to read, or not easy to read something like that. Something so powerful and such a clear message. One thing that emerges for me so clearly, and I'm sure everybody here would agree with me, is, you know, two words that bounce out. One is immense courage from both of you, and love. That's it's courage and love. And also to have the bravery to sit up here and, you know, talk to these people here, and also anybody at home who's listening. So really, thank you very much. Thank you both for sitting here with us. Something that has emerged, so we invited, and I'm sure you're aware of this, that we invited many of you to submit questions before you attended today. And a lot of the questions, Alan, were around that element that you spoke about, which was, you know, if I've got children, how do I speak to my children about this? How do I talk about this? You know, and there's, you know, there's a lot of opinions out there about how we talk to children. And what's coming clear for me is open honesty, and being held in that honesty. Is that fair to say?
Yeah, and I think it's fostering a safe environment, really,
Right.
where your kids are. We all know our kids are more clever than we give them credit for at all stages in their life.
Yeah.
And it's taking the guesswork out of it for them at an age appropriate stage was where we went. And rightly or wrongly at the time, we now know that we did get advice, you know, further down the road, but we had to tell them. Our lives were turned upside down pretty much overnight. Her chemo started within 36 hours of diagnosis. So we'd no choice. And I'm really glad we'd no choice. So it was using little words, little snippets of information at times when it suited them, not at night time, mostly in the morning time when we were one-on-one, not both together, because they were different ages and they could take it differently. You know, little things like that. But it's not rocket science. For us, it was just more been not going back to that natural openness, but for an age appropriate level. You know, not telling them that she was likely to pass away from this, you know, from the get-go, because they didn't need that trauma that early in the journey. You know, they needed it right at the end, not any sooner. But they had to know she had cancer. They had to know our lives were going to change probably forever, and that mum wasn't going to be, you know, look the same. She wasn't going to be able to act the same sometimes because she'd be sick. But all of those little things just helped frame it for them and build that environment to a point now where I think I probably have a relationship with the kids where, you know, they're able to ask me questions. They're able, like a week ago, my youngest son really struggled with the permanency of death, and that was a real challenge. And he, you know, 2 years down the road, he'd say things like, when is mommy coming back? And you're kind of going, oh my God, that's like, you know, we've been through so much, we've said so much, but it was just his stage of development. But he's now at the point where he came into me the other night and he just burst out crying. And that hasn't happened in probably 6 months. He's 11 now and he's a typical boy. But he felt safe to come into me. And that's all from how, you know, Jenny initially handled it and how we rolled together at that time. So yeah, honesty and openness were the key.
And that instinct is paying off now, even though it still is suffering, even though it still is upsetting. It has paid off in terms of that openness, and your son is allowed to come in and cry and be supported then. And for me as well, it was like
the fact that I was able to cry and be open with him,
Sure.
and it was a two-way thing.
Yeah.
There was one time after she died, and I had tears in my eyes, but I wasn't crying. And he came over to me and said, "It's okay to cry." So that was the mentality that we'd
Wow.
built up
Yeah.
in the family, which
Yeah.
I think for any age, it's important that, you know, if you're a spouse of somebody who is going through cancer at the moment, it's okay to be upset. It's
Yeah.
okay. You don't have to be that strong person, you know, all the time. You're nearly being stronger by being, you know, that little bit vulnerable,
Yep.
because you realize what's going on, and you know. So look, I'd never experienced any loss in my life until this, and we learnt as we went, and I just think that we were lucky that we, you know, fell into it
Sure.
the way we probably should have. But it's
Okay.
and I'm grateful, very, very grateful that we did.
So there's a sense of hope in all of this, right?
Yeah, and
Yeah.
like I spoke to you about hope, and hope is, to me, is one of the most powerful words that ever existed. Like, we were presented with an impossible diagnosis, like an absolutely impossible, but driven by Jenny, the hope was that she could be in that 2, 3, 4, 5, or 6% that beat stage 4 pancreatic cancer.
Yeah.
And that is what drove her on to not get 3 months, but get 12 months nearly to the day. And if things had gone a little bit differently, she could still be here, because that pancreatectomy was really successful.
Sure.
And, you know, there's hope delivers so much in really, really dark situations. And
Okay.
that is one of the biggest takeaways for me, was the hope that she could get through it, and it drove our family on, and it still does. You know, hope is, I spoke at her funeral about being eternally grateful for the life that she had, because she lived a really fulfilled life, and that all came from, and the hope is that I can develop the kids to be young men who also live really fulfilled lives. So it lives on, and hope is strong.
Absolutely.
And I'm not a philosopher of any type. It's just a
Well,
word
beg to differ. Yeah.
it's a word that I just hung on to, and Jenny hung on to, and it served us well.
Yeah. It's a magnificent story. So thank you very much for telling everybody this story. So I promised you we'll come back to Maria, and we are coming back now. And Maria's doing some fantastic research at RCSI, School of Population Health, in this particular area. Maria, can you give us an idea of the broad research concept? And then if you could tell us, or even summarize, because I know it's a big field, that what you're finding from the research in terms of what are the best practices? Because, you know, Alicia mentioned that, yes, there's the physical thing that everybody, the physical battle that people have to go through, but then there's the emotional and psychological battle. And what are you finding in terms of the best things out there that are evidence-based? Because in the MyHealth series, we talk about the evidence base. What is the evidence base? What's it saying out there?
Sure. Thanks, Pádraic. We were joking beforehand that whoever comes after Alan will have a really tough act to follow. So I've drawn the short straw there for sure. So, I'm carrying out a piece of research at the moment called the ENHANCE study, and it's actually funded by the Irish Cancer Society and the NCCP, the National Cancer Control Programme. And our goal is to identify the most effective treatments for depression, specifically among patients with cancer. And then we've also carried out some qualitative research as part of that with focus groups, so interviewing healthcare professionals and patients about their experience of treatments for depression and their views on the accessibilities of these in Ireland. So and I suppose it's just to say it's a really important topic, because we know that depression is so common among people who have experienced cancer. It's more common than in the general population, and it can have such a major impact on people's quality of life and their health outcomes as well. So it's really important that depression is identified when it's there, and that appropriate treatments are available to people so that they can receive the support and care that they need. Yeah. And there are lots of different treatments available. So they range from things like psychotherapy, and Vicky can talk about all the different range of psychotherapies that are available. Pharmacotherapy is very helpful for many people, so use of antidepressants. Often they'll be used in combination as well. Exercise, we know, is really effective for depression and also for other things like fatigue. Many patients would experience fatigue even long after they finished cancer treatment, and exercise is very helpful for that. And then there are lots of different complementary and alternative medicine approaches as well, like acupuncture, which patients find really helpful. So one of the key findings in our study was that a lot of the strongest evidence for a treatment approach is actually for collaborative care. And collaborative care is a multi-component approach to managing depression, where there is a really integrated model of care where specialists from different domains, so psychiatrists, oncologists, nurses, and primary care providers work together in an integrated way to identify a patient's needs and the supports that are best suited to them. Because, as you said, it's very individual. And crucially, with collaborative care, you generally have a person who is the liaison between the different specialties and the patient and helps to manage that for them. And that was definitely something that was very much supported in the interviews that we did, the focus groups, where professionals and patients really valued, really supported the idea that depression has to be treated in a holistic way. So there's no one solution that is going to fit everyone. And they really valued having that one key link person who was able to direct them and signpost supports and have that contact number that this is the person I can call. And often in the Irish hospitals setting, that role comes down to a clinical nurse specialist or an advanced nurse practitioner, and they play such a crucial role in terms of signposting the various supports and sitting down with the patient and really going through, this is what it looks like, this is how you might feel, managing expectations around, what happens after cancer treatment. Because, as you were saying earlier, when you're in that treatment cycle, you have all your appointments, the path is really clear. You're just going from one thing to the next. But afterwards, and to quote a participant in the focus group, patients can feel that they're just dropped off at the end of treatment, or they're kind of set adrift, and that support structure is gone because they're not linking in with people all the time. Sure. And often they feel then they have to navigate that for themselves. So having that link person who really helps them to identify, what they need. And there's such a big range, so I suppose distress is universal. It's almost universal. Everyone who faces a cancer diagnosis will experience some level of distress. Sure. But the level and the type of distress that they experience is so different. And for many people, it can be very mild and transient, and all they might need is the support from their cancer care team and someone to sit down with them and discuss their needs and what are the things that are contributing to their distress. And it just might be a bit of education around that, and that might be enough. But for other people, the distress can be severe and it can be persistent. And sometimes, like Alicia was saying, it can hit you years after you finish treatment. And right. Sometimes making that connection is really, really difficult. And so it's really important that the level of distress and the type of distress is understood, because that is really important because it guides what supports and treatments are most appropriate for any one person. And that varies. It's such a broad range. So some people might benefit from just going to a support group or talking with someone, or the helpline, and that can be enough. But for other people, they may develop depression or anxiety, and in those cases, it's really important that they get help from someone who's an expert, specialized care, from a psychologist or a psychiatrist, because they really need more supports around that. Sure. To actually treat that depression. And I suppose an important point as well is that, experiencing distress and symptoms of depression are really normal, but it's really important to differentiate between what's a normal response to a really difficult situation and what's more than that. And that's really difficult for anyone to do.
Yeah.
It's really difficult for experts to do,
Yep.
you know. And with cancer, it's very tricky because we know that there are so many aspects of cancer, the actual disease itself, and cancer treatments that can actually impact on your mood.
Sure.
There are lots of the logistical, factors around organising going to treatments. You know, your normal life goes on. You still have to look after the kids, make dinner, do all of those things, added to everything else. So there's, we're talking about getting parking in St. James's Hospital. You know, that is
Real things.
It's there, it might seem like a small thing, but in the everyday life of a patient, that is hugely stressful.
Yep.
So unpicking all of that and figuring out what's going on, what are the contributing factors, what does this person need, is really, really difficult. And that's very hard to do. But when you're linked in with your cancer care team and the clinical nurse specialists, especially who are, really skilled at this, and clinicians like Vicky, they can help you to do that. So if you are experiencing those symptoms, it's really important. And like Alan was saying, to be really open about it, to talk to your family and friends, let them know what's going on, and then seeking professional help for that.
Thanks very much, Maria. So what I'm taking from that is then that multidisciplinary, cross-collaborative care that is available. It's available from the Irish Cancer Society. It should be available from Psycho-Oncology, wherever you've received your treatment. So it is there. If it goes beyond, let's say 9 years, when we were talking about Alicia, I mean, what does that person do? I mean, can they go back into Psycho-Oncology, Vicky, or what's available to that person at that point, let's say?
I think that's the piece that's a little bit more difficult, is that our services are great, but they're not perfect. And we would love to be able to meet people for many, many years post-treatment, but the resources aren't there. And that's where we call on ourselves to advocate. I don't know that it is common knowledge for anyone who hasn't been through what you guys have been through and what we see every day, that this changes you, essentially. There's resilience there and you develop coping strategies, but it's difficult. So we always welcome people to come back to our services when we can. Our Irish Cancer Society services are always there. And to give a plug for a wonderful program which the National Cancer Control Program runs, Cancer Thriving and Surviving. And I've mentioned Billy earlier. Billy, you're here somewhere. Billy's a master trainer in the Cancer Thriving and Surviving. And what's unique about that program is you can access that online, in person, at any stage after your cancer treatment. And it is run not just by healthcare professionals, but someone who has had a cancer diagnosis themselves. So they've been there, done that, and they have the experience. So that's something that is there for people. I'm not going to say the rest of the services are absolutely perfect, but please advocate with us and let's see what we can do.
That's great. That's a really important message. So we could stay here all night talking about this topic for the rest of the week, really, but we can't, unfortunately. And one of the important things about the MyHealth series is that we like everybody to go away with something practical in mind. One tool that you can put into your pocket, you can take away, that's practical, you can use, or you can keep in your pocket for a future use. So I'm afraid I'm going to have to ask my friends in the panel to be very brief here because we are running out of time. But if there was one thing in terms of a nugget of advice or support or whatever you think is most relevant from your particular areas, what would that be? And I'm going to start with you, Corrinne, if that's okay.
I think always be open and willing to talk, and just to follow on from what Vicky said earlier about, years after somebody's a cancer diagnosis, like you can call the support line 1-800-200-700 and you can talk to a nurse 6, 7, 8, 9, 10 years later, and all of our supports are for people at any stage, and that is 5, 6, 7, 8, 9, 10 years later. So don't ever be afraid. Whatever you're feeling is normal, and I think that's a big thing. People feel that if I'm feeling this way 6 years after a cancer diagnosis, it mustn't be normal, but it absolutely is.
Sure, thanks very much. Alan?
I've so many words, but I was wondering which one to choose. So I will go with embrace. And so embrace your oncology team, embrace your oncology nurses, embrace psycho services, whatever that term is.
Happy to be called that.
Embrace your family, embrace your friends, and it'll make it a whole lot easier.
Great stuff. Thank you. Alicia?
I think advocacy for yourself and taking back control and ownership over your health was a really important piece for me. I'd love to get into it, but we obviously don't have time with the time constraints, but fertility was a huge piece for me, and I'm very lucky to be sitting here pregnant. But that was something that obviously was very relevant to me later in life after my diagnosis. So speaking with your clinical nurse specialist, linking in with the Irish Cancer Society and all the services available to make sure that when you transition out into the world, you're advocating, taking ownership of your health, taking back control, and utilising all the wonderful supports that are around.
Great, thank you. And psychotherapy, I think you mentioned
And please
before.
all go
Yeah.
to therapy. It's wonderful. I just love therapy. It's great.
Good stuff. On that happy note,
I'm
Vicky?
going to start awaiting this. So my word is resilience. And don't forget the coping resources you already have. Sometimes you forget. You've got to where you are because life has thrown things at you. And this might be a slightly different situation. And yes, you might need some services to augment or just prop up the things that you already know. But trust in your own coping resources.
Great message, thank you. And then finally, Maria.
I think I'd say that it's okay not to feel okay, especially after you've come through cancer treatment. So it's really normal to have concerns and worries and to feel low. But just because it's normal, it doesn't mean that it's insignificant. So it's really important to reach out and get supports. To connect with others and to try and seek help for that. And it might be, that you don't need a huge amount of support, but it's better to seek it out because it's really, really important to look after your mental health. And, some of the participants who took part in the study would say that actually that was the toughest part of their cancer journey. So if they were to choose, they go through the cancer treatment again, but they don't ever want to feel like they felt at the time. And I think that's really powerful because, we hear all about cancer survivors in the media and how, they're running marathons and setting up businesses, and they're amazing, and that's really great and inspirational, but that is not the typical experience, and sometimes that can be very alienating for people. So just because you don't identify with that, it doesn't mean that you're not coping well. It doesn't mean that you're failing at being a cancer survivor. But it's very difficult sometimes to see that when we're surrounded by those stories. So it's okay not to be okay.
That's great, important words. Thanks very much. It's really important for me to thank this wonderful panel here tonight. I'm sure you'll agree. So we'll start with Corrinne. And on my behalf, thank you, Corrinne. Thank you, Alan. Thank you, Alicia. Thank you, Vicky, and thank you, Maria. I think it's been a great success. And we hope to welcome you again in the flesh as well as on the podcast.
So just to close out, can I just thank Pádraic and the wonderful panel again, and particularly Alicia and Alan for being so open with such heartfelt, powerful stories. I'd also like to thank all of you here today. Many who have direct experience of cancer, be it themselves or your family members. And as Pádraic said, the podcast will go live on the 27th of November. I'm going to call out the Irish Cancer Society support line number for one more time. I think everyone has it, but it's 1800 200 700. So please keep that in mind. I'd also like again to thank all the exhibitor support stands who are still present When you go back down to the Remedy Cafe, which is back up through that door and down the stairs, you have another opportunity to meet the support stand. And can I thank our MyHealth committee, led by our head of communications, Louise Loughran, and her team, as well as all the RCSI support services who provide such support to run events like this. And with that, I'd like to invite you down for some refreshments. So thank you.